Hi, everyone. Thank you so much for attending our surgical internship panel. My name is Ashley. I am the WCVAS Training Section Executive Chair, and I'll be helping to run this event with Sriya, who is an MS3 at UMKC. So the host of today's event is Dr. Ahmed Farag. He is a vascular interventional radiologist who completed his surgical intern year at Greenville Memorial Hospital, his radiology residency at the University of Kentucky, and his fellowship at Baylor University. Our next speaker is Dr. Ahuja. He is a pediatric VIR. He'd completed his surgical intern year at USC LA County as well as at Einstein Medical Center. He completed his VIR residency at Einstein Medical Center as well and his pediatric VIR fellowship at Boston's Children's Hospital. Our next speaker is Eric Cyphers. He is a current PGY1 at Lenox Hill Hospital for a surgical intern year, after which he'll be starting his VIR residency at USC. Our next speaker is Jonas Cruz. He is a PGY2 at UCLA, and he recently completed his surgical intern year at UCLA as well. And we also have Nikita Murali, who is a PGY4 at Northwestern. She completed her surgical intern year at Kaiser Wisla. And lastly, we have Austin, who is also PGY4. He is a current KP Wisla resident, and he completed his surgical intern year at Kaiser as well. So I will let Dr. Frog take the floor. If not, I could start by asking some questions.
All right, can everybody hear me?
Yes, we can.
All right. So thank you for the introduction here. And give me just one second. There we go. So again, thank you for the introduction. I think this is a really awesome topic, and I think it's really important. It's something that I get this, you hear this question all the time from the students, the fourth years going into interventional radiology, and kind of wondering, what is the next step? So you're thinking about your career as a whole, and you're trying to get to this level, which is vascular interventional radiology. And how do you prepare yourself? And for a lot of people, they think, okay, the intern year is just a year to get through something that you go in, you do, it goes by quick and you're done. But what they don't realize is this gift of the intern year that really sets the tone for your vascular and interventional radiology residency and fellowship. So if you ask any program director in IR, and just kind of say, what gets you prepared? Who are the best residents? Who come in ready to rock and roll from day one? Who has their metal tested, and who's prepared for interventional radiology? And just about all of them are going to tell you people who did a surgery internship are ready to rock and roll. So I personally, and I say I gifted into getting surgery because at the time I didn't know it, but I went to a surgical program that just from A to Z was really amazing. So there was nothing easy about it. I'm not going to sugarcoat it and say it was easy, but it was a very difficult year. But every day we got in, we rounded, we went through imaging. We did a ton of procedures throughout the day. And from where you started and where you ended, you were really just a different person. You were able to handle a high case volume. You could scrub into cases and see consults. And you kind of, when you think of getting multiple crazy cases at once and learning how to triage, that's just something that comes with a lot of time and practice. So the topic of here is why we're doing a general surgery prelim, and we're going to kind of talk about all the benefits from A to Z. And we have some really amazing people on here that are going to help us out. But I'm not gonna ruin it all at once. But I think doing a general surgery prelim year is the way to go. All right. So let's get some questions going, and we'll kind of open up the dialogue, and we'll talk more about it.
All right, sounds good. I guess I'll start with a question for Dr. Ahuja. What are the benefits of completing a surgical intern year as compared to a medicine or transitional year?
So it's simple. If you want to be a surgeon, be the surgeon. Don't be a physician. Don't be an internist. It's a very, very simple saying. You're trying to have a surgical lifestyle. If you're trying to be a surgeon, this is not a radiology. This is vascular interventional surgery. You don't go to the swim team without learning how to swim. You don't play table tennis and go into a swim team. So it's as simple as that. If you know how to manage a patient who is critically ill, that's what is going to get you through your vascular interventional surgery residency and as your career as life. You cannot pay me enough to not to have something that will make me more happy than what I'm doing right now. So yes, there is a lot of chatter about burnout and radiology, and then having a backup and reading and making more money. But for me, the most important thing that matters at the end of the day is my happiness. I am happy doing procedures. I'm happy taking care of the patients. I'm happy giving them longitudinal care. I'm happy to see them in the clinic. I'm happy to give and take hugs. That's what makes me happy. Yes, to each their own. If reading images makes you happy, please go do that. Don't discount that for anything. If that's what makes you happy, if you're going to try to juggle, that's really not going to make you happy either. At the end of the day, what matters is what you really enjoy doing and what you think you can do for the next 30 years of your life. And if you want to have a surgical lifestyle, be a surgeon. That's why doing a surgical internship is more important than learning how to do medicine, because that's not what you're doing in vascular interventional surgery residency and your career.
Thank you for that. Our next question is directed towards Nikita. How did your surgery intern year prepare you for your VIR training? And I'm asking the rest of the panelists if you could please put your responses in the chat as well.
So my surgery year was actually pretty critical to the rest of my radiology training. I think a big part of the referrals and consults that we get in IR come from surgeons. And it was really helpful to know what these surgical alternatives are to whatever we were offering as treatment. So just knowing the landscape of what's available surgically and how different problems are surgically approached is really helpful when you're interacting with your surgical colleagues. So that's the main way, I think, as well as just surrounding procedures. The peri-procedural care in IR, when done best, I think is pretty similar to how pre and post surgical patients are managed. So just learning some of the basics of that has helped me, especially in challenging clinical situations when patients are decompensating and things like that.
Great. I'll also direct that question to Austin if you could answer the same question.
Sure. Yeah, I think there's like I put in the chat, there's so much crossover between surgery and VIR. We treat so many of the same disease pathologies, and so learning what the surgeons, how they think about it, how they approach it, what their surgeries entail, possible complications, and then just seeing how they take ownership of the patient, I think is so critical. And also when you're operating, I think you learn the anatomy so well, much better than you can just from looking at imaging alone. And then I think the technical skills also, and seeing how the surgeons deal with operating in terms of how they approach it, what happens if they run into problems, and then how they manage their patients afterwards. All of that is just so applicable to VIR because that's what we do. So I really think that there's no better alternative.
Great, thank you. I'm directing my next question to Jonas. What do you think the optimal intern year for a VIR resident should look like?
Yeah, good question. I could talk at length about this. I think you do the surgery intern year because people tell you to do the surgery intern year, but going through it definitely solidifies that two things. One, a surgery intern year where you are dealing with sick patients, not just operating. There's a lot of benefits to the operations, but we deal with a lot of liver pathology, and it's one thing to understand the procedure on the table. It's different to be the intern overnight in an ICU where 40 patients with a MELD of 36 and you are responsible for all the orders. I think that instills a lot more confidence in managing those patients both during a procedure, after procedure, things like that. Second, I would say one where you are seeing a lot of patients in clinic. I think that you get a skill set where, say, you're on vascular surgery, you're also, in addition to your floor patients, you also have a clinic caseload. I think things like that, whether it's vascular surgery, whether it's surgical oncology clinic, things like that, those reps really do stick with you when it comes to following those patients down the road. I learned a lot about the patients that I was going to be dealing with down the road by just seeing them over and over and over again in clinic, both inpatient, outpatient. And then something that I've come to appreciate is doing your surgery at the same hospital that you're going to be training at after that. That's not always, the case, but I've found a lot of benefit to knowing the departments really well, being within those departments, then now being, related to those departments. I think not just understanding yes, the workflow, the EMR, things like that, but actually knowing, okay, this is how the liver transplant service works at my hospital from the inside. And now as I'm working adjacent to them and collaborating with them, I know how they operate. Same with the other surgical services. And I think that has gone a long way to now being on this side of things. So I would say a surgery intern year where you are operating, where you have the opportunity to go to clinic frequently. You want to be busy. You're gonna do an intern year. You might as well get a lot out of it. And being at a busy service where you are, tasked with a bunch of different types of surgery patients, and then I would say try to do it at the same institution where you're going to train after that. I think there's an extra benefit to that.
I just want to add on to that too. When you're looking for a surgical intern year, you can kind of tailor, and we talk about this in the chat, but you can go to a place that you're not just going to be doing scut work all year. You can go to a place that's going to let you get into the OR. You can ask them, say, hey, I want to do a month of vascular surgery. I want to do a month of thoracic surgery, ICU, a month of IR, and they're almost always going to give it to you. I think when I was at Greenville, I think it was the first intern in history that asked for 2 months of vascular surgery because everyone else hates it. It's a lot of work, but for you, it's going to be heaven. You're going to get, endovascular cases all day, all the stuff that none of the general surgery residents are going to want to do. You're going to get those cases because we like doing them. And then you also want to make sure you go to a place that is going to treat you like another one of the residents. You don't want to be looked at as a prelim. You want to be looked at as one of the residents because you're there to learn surgery. Okay, so you can really, from the day you match, you can text your program director and say, hey, I want to do this, this, and this, and they'll almost always work with you on it because they like that. They like to see the initiative, and all the other surgery residents are going to just jump at the idea to be able to give you those rotations.
Yeah, I'm kind of right in the thick of it right now, and it is super hard and taxing, but I think it's definitely the move if you're going into VIR. I think, first it's the procedural aspects. I think that shouldn't be the bulk of what your intern year is, but it's important. And, just this weekend on call, we had an emergent TVAR, which was awesome, a splenic embo. I got to scrub a bunch of cases with Dr. Robert Rosen, do a bunch of vascular cases, which is great. And I think any OR time helps your future career. But I think surgery is the move because you get the medical management and the surgical management. You'll find that there's a lot of pathologies that people can get admitted to both medicine or surgery for, like a lower GI bleed. You'll learn the medical management and the surgical management. I think the second biggest thing is, aside from the kind of medical knowledge, is the efficiency. Some nights you'll be by yourself with 28 patients, and you just have to figure out how to get people the care that they need, triage, and then round on them the next day as if you had a much smaller caseload. I think those skills are very difficult to learn, but I think they're going to pay off when you're caring for very, very sick patients, you're getting consults, and you have to operate in the future.
One thing I will tag along with this is the importance of knowing the language. And what you do in the world of VIR and the world of surgery is the language is very similar. If you want the people to come and get your opinion and see what you can help them with, because remember, majority of the times, like actually a lot of times, you are the last resort for most of your patients. So knowing how you talk to the people and talking their language is very important because, just like right now, I am working with a lot of pediatric orthopedic surgeons and oncologists to develop the pediatric MSK interventions and talking to them about their language, which I kind of never learned before. nobody ever taught me. So for example, like axial loadings and pedicle reconstructions and doing the joint fusions and calcar femoral, like the breakpoints, knowing and talking to them in their own language obviously makes the relationships very strong. So if you know that language when you have done the surgical internship, it actually goes a long way because then you know what exactly they are looking for. So you develop a very strong relationship, which would be long lasting rather than having the turf wars, which is quite common in many places.
Kind of adding to that, I think speaking of knowing the language is learning the anatomy and in real time, like Jonas said, but rotating through these different surgical services, you learn a lot of post-surgical anatomy. You know, some you're familiar with your basic choles and appies, but my center does specialized colorectal cancer, and you're going to have to read those scans as an imager and operate on those patients with anastomoses and ostomies that you've never heard of unless you know the language and you know it can go wrong. And I think along those lines of knowing what can go wrong is learning from a surgeon about what scares them. I think we can get good at looking if a patient is sick or not sick, but I think caring for very ill patients as a surgeon, you learn when someone is about to get sick, what scares a surgeon, what they look for in the PACU. And I think that'll be huge because you'll be on the other end of that someday as a consulting VIR and have to understand the issue and take care of it.
All right, so our next question is, are there any pitfalls you'd be cautious of when applying for a surgery intern year? I'll start by directing this question to Eric.
Yeah, I think like what Dr. Frog said is knowing if they're going to treat you like kind of scut or treat you like one of their own. Because you will be doing floor tasks, they will be mundane, but you also need to get your education and you need them to put an equally heavy workload and then as follows like a trust on you. I think you should look at what the hospital has and what they don't have. I know Jonas's center does trauma, transplant, hepatobiliary. I think that's really huge. That's going to be key. My center does not do trauma. They don't do transplant, but my program is run actually alongside the vascular department, so we get extra vascular blocks. So I thought it made up for that. I think there's a lot of benefit to being maybe an intern at a community surgical program, but I think you really want to be at a high level, high acuity center that's going to have a lot of very sick patients for you to be in the surgical ICU, the medical ICU, the emergency room, because while, you know, you'll get really good at the basic surgical pathologies, like maybe somebody with left lower quadrant pain, you need to know some of this advanced stuff that not all hospitals have. I think you should ask for caseloads from the intern to see what kind of cases they were scrubbing, how often. And I also think you should look for ACP support. I'm lucky in my program, we have about one ACP per intern, and that really helps as they do some of the more like paperwork tasks. You can really get more into the medical and surgical management and, you know, working up consults with attendings.
I'll also direct this question to Nikita if you can answer it.
I agree with everything Eric said. I think those are all great things to look out for. I think one key thing is clarifying for yourself what you're looking for in a surgical internship program. So I was looking for a lot of things that Eric mentioned, but my plan was to end up at this more academic place for VIR. And I knew that if I were to do the internship at the place where I was intending to match, that I would not get a lot of OR face time because in a lot of very traditional academic settings, you end up spending a lot more time on the floor. But I did want to get in the OR and get a lot of exposure to a lot of different things. So that was part of the reason why I decided to do my intern year at a different hospital where I did the rest of my advanced training. And I'm really happy I did that because, at least for me, my experience at Kaiser was phenomenal and ticked a lot of the boxes that Eric was mentioning. So I think just being very clear on what you're hoping to accomplish from that year will help you select a program that will meet those needs. And for some people, it may mean not having to move between your programs, and for others, it may mean having to move for just a year if you care enough about your surgical experience.
Thank you. Our next question is for Dr. Farag. What advice would you give about how to approach your surgical intern year?
Oh, that's a great question. So you want to, and like we alluded to earlier, you want to look at your surgery intern year like this is a year building your foundation. It's not a year to run away from. This is a year where you can really test your mettle, get in there, get in the OR, sharpen your skills, ask the questions. Don't be afraid to really get on the floor. This is a year where you should really be taking on, there's a lot of times you get a list, okay? And that list has sick patients, okay patients, and just easy patients. You really need to challenge yourself with see the sick patients, run through it with your chief and your attending, find out what's going on, get on the harder cases, ask to suture, ask to get into those surgeries. If there's a really hard endovascular case, get in there and make sure you're getting your hands wet and you're actually able to do stuff. So this is really just your foundation year. This is a year where you're going in, you're not knowing as much, but by the end of it, you're going to get faster, you're going to get smarter, you're going to get better. You're really just building yourself up to get into VIR ready to rock and roll. Okay. This is where you're really building that foundation of being able to succeed as a vascular and interventional radiologist.
Great. I'll also direct the same question to Dr. Ahuja if you're still here.
Yeah, so as Farag said, it's all about the foundation. And I keep coming back to personal examples because, obviously I know more about what I do. If you have a foundation which is very strong, the name of the program that you come from doesn't really matter. What you bring on the table, that's what really matters. Just for an example, I have done a Whipple surgery before and I know the anatomy. And my foundation from the surgery, I already knew how they anastomose the hepaticojejunostomy and how the end-to-side anastomosis is. Now, on last Thursday, I did a case where a patient was post-Whipple and she had disrupted hepaticojejunostomy with complete stenosis and pretty severe biliary ductal obstruction. And she was in severe distress with cholangitis. And obviously, we needed to place the drain. And it's impossible for an endoscopic placement of the stent because they just cannot get there, right? Like it's hepaticojejunostomy, it's post-Whipple. So anatomy is completely distorted. So the last resort for this patient is us. So now knowing that how the hepaticojejunostomy is done, I was not easily able to figure out because this was a little different way it was done. So just remembering what I learned back in the surgery days, and there's different versions of hepaticojejunostomy that were done, I was able to give her a neo-reconstruction of the whole hepaticojejunostomy with cross-stenting from both the ducts into the jejunum. Now, obviously, I've never done it before. My point being that my foundation was strong enough to give me that idea of how I can work out this plan so that this patient can, whatever time she has, whether it's 6 months or a year, she can have a good quality of life. As many have mentioned, some patients will come to you where you are the last resort or they are going to die. So knowing your anatomy and how strong your foundation is, that's what really matters. Going through a surgical internship, where that's what the process, how it starts and your foundation starts building, that really matters. Because think about this, your surgery internship or internship just in sense is not the last vacation you're going to have. If you want to become a really good and a strong VIR, you really have to start during your internship. Internship is part of your training. It's not a fun 1 year before you get into the grind of it. So if you don't start now, you're probably going to be slacking and you may or may not catch up. And it's a very steep learning curve once you start doing radiology because you're going to be pushed into the world of imaging for 3 years. Yes, you will get some IR time, but it may not be enough. So utilize your surgery internship and make it the best one. If you're not going to do it, you're not going to be really happy. You may quit during the residency or you may just quit immediately very soon after you graduate and you may want to live the life of a teleradiologist, which is what is going on right now.
All right. Our next question is for Jonas. What qualities do you believe make someone a strong surgical intern?
Number one, showing up early. Two, never making excuses. I think as a medical student, there's this pseudo barrier of like, oh, if I don't know something, the resident will know something or the attending knows something. Somebody who's a really good surgery intern takes ownership over their patients. And so if something is wrong with the patient, or if the resident asks you, okay, what's going on with this patient, you should know that patient. And I think a lot of that comes from just this intrinsic drive to, okay, these are my patients. I'm gonna learn as much as I can from them. I'm gonna know everything that's going on with them. And then a natural curiosity. I think a pitfall that can happen in surgery intern, depending on the culture of your surgery program, is how often surgery consults other services. It's not that the surgeons don't know that material or that they're, trying to punt things, but sometimes whether they're busy or for whatever the reason is, diabetes, hypertension, things like that, they'll just consult a bunch of different services, and nobody can stop you as an intern from being a doctor. So if you take it upon yourself to learn the ins and outs of their pathology, whether it's a surgical pathology or not, that's just going to be to your benefit down the road. And then a willingness to step in and say, okay, I'll take care of it. I do think that one of the biggest things that you take away from it is an ability to just get it done. There is, a lot of things to get done, and sometimes it feels like there's not enough time in the day, but you get better and more efficient as you go. You get faster at rounding, and it's not that you're cutting corners, you're just getting more efficient. And so being willing to step and say, okay, I'm going to stay late to figure out how to do this, and the next time it'll be a little bit faster. You just build this skill set to where now, I mean, you're a lot more confident with that kind of stuff. So I would say taking ownership of your patient, not cutting corners. It doesn't matter if it's 2 a.m, they call you, you can try to push it off. You're going to go see the patient, you're going to see him on the floor. That's your patient. And being willing to be curious and learn. I think all of that serves somebody really well down the road.
Thank you. I'll also direct that question to Austin.
Yeah, so I mean, agree with everything Jonas said. I think being proactive is really key. Trying to anticipate what the team needs next. What the next step in the surgery is. Should you consult the service for this patient? You know that your team's going to ask. Should you? Is there like anything you can do on the floor that can help the team? Just like being proactive and being as helpful as possible. I think that will kind of define you as a good intern. And then something else too, as someone who is very detail oriented in terms of you want to be efficient, but you also want to do things the right way. So don't be sloppy. Make sure that you have a list that you take care of and you go through it in an organized fashion. Make sure that even like the little things you do correctly. And then that way, if they see that you take pride in your work and that you really care and that you're working hard, the surgeons will be more inclined to, involve you more when you're actually operating with them, or they, may give you more responsibility just as the year goes on. Um, yeah, exactly. Like Jonas is saying, lean. You want to approach the surgery intern year as if you are going into surgery. Um, and something I mentioned in the chat, but you really want to take this year to become as strong as you can on the clinical side. So, be efficient, learn how to write your notes, learn how to put in orders, learn how to manage patients on the floor perioperatively. Because PGY 2 through 4 during your diagnostic heavy years, those skills are just going to fade away. And fortunately or hopefully, if you go to a program where it's integrated, you'll still keep some of those over the years. But especially if you don't, you want to get to your highest point. It's like bone mineral density. You want to maximize your peak, and it's going to fade over time. But the higher your peak, the better off you'll be come around like PGY 5 year.
Eric, I was curious to know whether you have any unique insights considering you're currently doing your surgery intern year.
Yeah, I'm kind of in the middle of it every day trying to evaluate how I'm doing with these things. I think like Jonas mentioned, that like intrinsic drive, I think you just wake up with or you don't, and you see people that do and don't have it. Are you willing to show up there early to take ownership of that list you're about to go round on? Are you willing to just get it done when you get paid? Are you the type of person who is not okay with leaving day work for the night people? Are you the type of person who's gonna, be proactive to go check that groin, check on that suture line? I think intellectual honesty is huge, knowing when you know or don't know something and knowing when to ask for help. Because now I find myself, we're closing skin or something and the surgeon leaves the room and it's just me. Do I know how to do that? When when the attendings ask you lab values or consultants call you for a question, if you don't know and you're not honest about it, it will affect patient care. But if you put your ego aside, admit when you need help, you'll get help and become stronger for it. Because you see people who kind of fake it and it always comes out in the end and it always affects patient care. And it's not about you looking good, it's about you coming stronger and the patients having good outcomes. And I think right now those are just things that I'm noticing and trying to work on every day.
Thank you. Our next question is, what advice would you give for MS4s who are currently applying into VIR residency and surgical intern years? And they want to make the most of their last year of med school. I'll direct this to Jonas.
So the question of how to use like your last 6 months of medical school.
Yep.
Yeah. When it comes, so there's stuff that you have required through your school, right? And then there's stuff outside of that. When it comes to lining up your last 6 months of residency or last 6 months of medical school, I tried to fill mine with rotations that I found stimulating and that I thought would benefit me down the road. So I did my last three rotations were vascular surgery, urology, and surgical ICU. And just having those three in a row right before intern year, I think was really helpful. I think figuring out, exactly what you're looking to get out of it. Now, I'm, there's some people like, oh, study for step three, stuff like that. Don't do that. Don't do that. There is something to like enjoying the accomplishment of, making it a residency, things like that. Still, it's a lot of work that goes into it to enjoy that. But I think gearing up for making the most of that next year, if you're just like in full vacation mode and you show up day one of intern year, it's going to hit you like a truck. So I do think somewhat getting your head ready that, all right, I'm coming into this to work hard and get the most out of it. And then I think something else that I found helpful is I was still going to conferences and things like that and meeting people and networking and doing the stuff that you're interested in. I think that all of those things help you find, how you're going to keep a balance when you go into intern year. So whether that's exercising, whether that's, a specific hobby or something like that, having some way to decompress and being in touch with that when you go into intern year, I think is going to help you throughout residency have the ability to just keep bringing your best every day. And yeah, keep up with research for sure.
I think Jonas really hit it on the money with everything. Keep up with the conferences, keep up with everyone going on. Really, really, really keep up with everything you want to do. But your fourth year is kind of a magical year in that, if you're like, okay, what's the bare bone advice? And that's, go in, do all the rotations, find the most badass IR or surgeon or whatever, and just tag along with them, learn as much as you can. But you don't also have to be on that rotation. Even if you're on another rotation, they'll let you off early. I promise you, no surgeon or no IR is going to say no if you're like, hey, I want to jump in on this awesome case. I remember doing that as a fourth year. I remember, when I was a resident, students would come in and they'd want to come in on cases. And that's the best time. Find a fellow who's, there towards the end and wants to teach you and show you all the tricks and make sure you're getting your hands dirty. You'll learn a lot from the people that want to show you stuff and are doing good cases if you show even the most minute amount of interest.
Yeah, kind of reflecting that it's the last time you can kind of have fun with it. Like I think you need to, like Jonas said, hit some areas that you're weak. So I did highlights for me during those last 6 months was cardiac ICU and a vascular surgery sub-I. The vascular surgery department was already done with their interview seasons, and I just asked to come. I was the only one, and I could pick and choose cases I wanted to, whether it's learn about angio, see, open aorta. I think never again in your life, in your medical training, will you get that freedom to just hop around to cases, to pathologies that you want, and just be there totally to learn. I wish I could go back and do it. It was a lot of fun. I spent, you know, a ton of hours in the OR, a ton of hour on rounds with people I'll never be rounding with again, but it was so valuable to patch up those weak points. And then I think you do have to take some vacation. I took a month and I felt kind of rejuvenated enough to hit the ground running in my intern year.
Austin, do you have anything else to add?
No, not really. All great responses. Yeah, I mean, like Eric was saying, I think take the fourth year seriously. Learn as much as you can, but then, also make sure you take an actual break. Because intern year, especially if you do surgery, will be tough. So make sure you find some time to decompress, travel, spend time with family, whatever it is that makes you happy. Um, yeah, I wouldn't recommend, going straight on from fourth year right into intern year. Definitely take some time off.
All right, now I'm going to open up the floor to see if anyone has any questions. If you have a question, feel free to unmute or just drop it in the chat.
Hi guys, thanks for your talk. I kind of appreciate the perspectives and everything. Um, I guess kind of going into, I think the hardest part is like sometimes a lot of these surgical internships, especially even at like community programs, aren't advertised well. And I think it's like kind of hard to find that info. What should I be like looking for, I guess, in terms of to figure out the best experience? I guess that's probably a loaded question and probably hard to give an all-around answer, but I don't know if there's been anything, just generally speaking, that's helpful for figuring that info out.
Yeah, I remember a few years ago there was some residents that they actually put together a list of general surgery intern years that they let you get, they had a good culture. They let you get in the OR, they let you get IR, vascular surgery, whatever you asked, and just overall great experience. And that list is out there somewhere. I don't remember exactly who it was that put it together, but I think they're revamping that list this year and updating it. So be on the lookout for that soon.
Yeah, I think there becomes like a list of known programs within the VIR community that are good for surgical interns. Of course, if you go to a more clinical categorical program, a lot of them should have really tailored internships for you. But outside of that, there are just known places that have a good track record for taking VIR applicants because they know that they tend to be harder working than other surgery prelim applicants and places that are known for treating you well. I think if you talk to enough residents, you'll get to know those list of programs.
Yeah, and if you're curious about something, just you can reach out to somebody who's previously gone there or something and just straight up ask.
Yeah, that's one thing is I think especially as a VIR resident, you really don't have a lot of skin in the game in terms of where you do your surgery intern year at. Especially if it's not at your home program. So if someone's like unhappy with their surgery intern year, they probably won't be afraid to tell you. And I think yeah, we do have plans to revamp the spreadsheet that Dr. Farag did and get it updated. But in the interim, I think if you're at SIR this year or ISIT or whatever, go talk to a lot of people, talk to current residents or people who just finished or are in the middle of their intern year and ask, oh, what's your experience? Are you getting to scrub a lot? Are you going to clinic? Is it a good culture? Do you feel like you're learning or do you feel like you're just, a scut monkey? Um, and I think, VIR is so small. You just ask people. There's a few programs that are known for being really good out there, and I'm sure you could reach out to any one of us. I'd be happy to tell you the ones I've heard of. I'm sure everyone has like, three or four that they know that would be good for VIR residents. So really just, reach out to the network that you already have and keep building it. And I think that's the best way for now.
Awesome, thanks.
Any other questions? We do have a question in the chat. Any advice for building and maintaining good relationships with our surgery colleagues throughout residency?
I think early on, one of the best things that myself and my colleagues did is give your number to everybody, exchange numbers, everyone you meet, make sure you, hey, this is my cell, call me for anything. There's some people that go through the paging and asking a nurse to page and doing all that, and it take an hour to get anything done. Or you pick up your phone, hey man, what's going on? Hey, what's going on with this patient? In 30 seconds, you have your answer and you have some synergy going on. So I would definitely make sure that you're available to everybody. Make sure you have the attendings numbers, your co-residents, your colleagues in every department. And I think that makes you, it's just a really powerful tool throughout throughout your residency. And also make sure you get to know them on a personal level. These are people you're gonna, a lot of times hang out with outside, and you'll see them outside. And when you see them in the morning, make sure you're also getting to know them on a personal level. There's, I think, just maintaining that collegiality and making sure that you keep open communications with them really helps out.
Something I'm learning a lot about is navigating politics between various departments and especially within surgery. Being in a New York program, that's pretty huge. And I think maintaining good relationships with referring services, with individual residents and attendings, it's a key skill to build because you're kind of all in it together. You're all consulting on the same patients, and you may get annoyed at referrals from them. They may get annoyed at consults from you, but I think if you can kind of keep that collegial within these pretty complex cultures that happen in medicine, especially like turf battles that we can see in VIR, I think that's one of those like social skills that intern year teaches you pretty well that I'm working on.